show in a bit. The time is 16 minutes past 8. And this morning we're going to be pulling the curtain back on a scandal that cuts to the core of South Africa's healthcare system, and it's uglier than we thought. A damning report from the long-awaited Section 59 investigation has rocked the medical aid industry. It unfortunately finds that some of the biggest players in the game have allegedly been racially profiling Black, colored, and Indian healthcare professionals, putting them under disproportionate audit and disciplinary pressure. Minister of Health, Dr. Aaron Motsoaledi, says he was shocked. Black doctors cheated, a system skewed, a power imbalance too blatant to ignore. But the industry body representing some of these schemes, the Board of Healthcare Funders, say the report is deeply flawed and could, if accepted, encourage runaway fraud and corruption. But is this really about fraud, or is it about who gets trusted and who gets targeted in post-apartheid South Africa's private healthcare system, which is, according to the report, if you are of Black and brown skin, then the latter is for you. And joining me now is someone who's been fighting these battles long before they made headlines. Dr. Kgosi Letlape. He's not only a respected health activist, but also the founder of the Africa Medical Association and former chair of the South African Medical Association, and he's here to help us separate, well, the spin from the substance. Dr. Letlape, thank you so much for joining us. Always a pleasure having you on Salam Media, and good morning.
Good morning to you, and good morning to the listeners and viewers. And just to say that I'm also a member of Parliament for Action SA.
Definitely.
The Committee of Health.
Definitely. And I think this is why it's very, very important that we have you in this conversation. You're someone that has been deeply involved with, provision of healthcare here in South Africa. You are part of these very, very important organizations and founded, some very, very important ones. What was your initial reaction when you read about that Section 59 report? Were you shocked, or did it confirm what you've known with the many years that you've been working within the South African medical fraternity?
It confirmed what we've always known, but it also confirms the old American saying that the arc of justice is the arc of justice is long, but it will always bend towards the truth. So this has come full circle. And what we're hoping will come out of this, for myself, it will be a couple of things. One, that the alleged fraudsters will be reported to the police so that we can clean up the profession. Secondly, the medical aides that have been involved in this heinous act should be criminally charged, because what they were doing, they were running a parallel state. Those units of theirs were doing uncovered mandates. They had no authority from the National Prosecuting Authority to do what they were doing. This was vigilantism. The innocent doctors that have been destroyed in this process need to be restored. There should be punitive damages to these medical aids. They should be charged criminally for circumventing the laws of this country, for aiding and abetting, so that the integrity of the profession can be restored.
Definitely. Doc, this report, the little that I read from it, found that, Black, Indian, and colored doctors were subjected to unjust audits and disciplinary action. In your experience, how does this racial profiling play out in the day-to-day lives of these practitioners? In reality, what does it look like? What are they subjected to?
Well, the first issue is to say this is against Black doctors. And Black, as we define it, includes Africans, Indians, and colors. What it would look like is that you would be profiled, apparently, from the background. And once you are targeted, you'd be presented with evidence that you've either been committing fraud or over-servicing or claiming for services not rendered. And you'd then be given estimates of what they've calculated, backdated a few years, and they'd say, this is what you owe us. They would stop paying you directly, and they'd want you to go to sign an acknowledgement of debt and start paying them back what they claim from you. No transparency, no due process, no evidence being led, no charges being laid against you. That is extortion.
And
And
very,
that is
very concerning.
and any doctor that would say, not interested, I've not committed any fraud, they'd be throttled. They'd stop paying you directly. They'd encourage their members not to come and see you. If their members came to see you, you'd deliver services and they'd reimburse the patient and not pay you. So all of it was just using their power to destroy practitioners, to threaten practitioners. It's extortion in its most basic form.
Hmm. One thing that was really interesting for me, it was essentially industry denial here from the Board of Healthcare Funders. They claim that the report's methodology, the way that it was conducted, was flawed, and that fraud prevention is essentially not racism. And their motive was essentially that was fraud prevention and not racism. And in a lot of ways, they're just saying it just so happens that majority of the fraud that is being uncovered by the Board of Healthcare Funders was committed by black and brown doctors. What do you make of that defense?
That's silly. There's no problem with fraud detection mechanisms from any institution. But once you detect fraud, that's a criminal offense. You provide the evidence to the police. You take the person to court. That's what happens in a country with laws. You don't create a quasi-state and vigilantism and proceed with labeling people as fraudsters. Fraud is a crime. And if there is an allegation, you go to the authorities with that allegation, you provide them with the proof, and you charge the practitioner with fraud so that we can rid ourselves of fraudulent practitioners. What you do not do is to collude with them, extort from them, and basically protect them and tarnish the profession. You don't do that. You do the right thing. I've dealt with them when I was in the Medical Association. I've dealt with them when I was in the Health Professions Council. And I said, these matters should be reported to the Health Professions Council because they are responsible for proper conduct of practitioners. No, they run a quasi-system. Nobody knows this monies that they've extort from practitioners on the basis that the practitioners were fraudulent or whatever basis. Where does that money go? Who funded these rogue units inside the medical aid industry? They cannot run a parallel state. Otherwise, they are condoning and abetting. They are assisting allegedly fraudulent practitioners.
Some very, very pertinent points that you're making there, Prof. Some
No,
have called
no plagiarism. I'm not a professor. I'm just an ordinary doctor.
doctor, excuse me. Some have called this a David versus Goliath kind of scenario. And I think it raised alarm bells in my head because what does this investigation say about the broader power imbalance between these schemes and also individual practitioners and doctors, especially those that are black and colored and Indian in this country?
It just says the arc of the universe is long, but it bends towards justice. Even Goliath will have his day. And we're glad that the minister undertook this exercise of setting up the structure to make the investigations. Because as an individual doctor, you'd never be able to make it. So as a profession, we will be grateful to the minister, but we hope that the minister follows up on this issue, that this matter is not swept under the carpet, that this conduct of the medical aids is punished in the most severe form, so that people should know. You see, for health to work here, we need simple systems. For health to work here, you need a national data repository so that we can see when a practitioner is earning the equivalent of working 72 hours in a day, so that the alarm bells should ring and those practitioners should be approached and the matter should be addressed. But what we cannot condone is vigilantism as has been exercised by these powerful, powerful structures. They should have their day in court.
Mm, mm, mm. And just speaking broadly, what role does institutional racism still play in South Africa's private healthcare funding space? I'm sure you've dealt with a lot of cases, with a lot of issues. Is it still as prevalent to this day?
Or institutional racism remains to this day. There's a matter that I'm dealing with that involves facilities at private institutions. And once it has been dealt with, we will come back to you. Institutional racism is the order of the day.
Mm, mm, mm.
You know,
Just
uh,
lastly,
uh,
and
uh,
yes.
you know, you have to understand that the sickness in the health system is quite broad. Institutional racism exists even in the training institutions.
Mm,
You know, from the HPCSA, we wrote to the Human Rights Council, Human Rights Commission, for them to investigate institutional racism and sexism on the training platform. Nothing has been done. Blacks, local blacks, which means Africans, coloreds, and Indians, still do not have access, equal access to the training system. The coloreds and the blacks are the worst treated in terms of access to training positions, promotions, and moving up the ladder. So institutional racism is alive and well in this country. And there are particular patterns that are used. For the Africans, they would prefer training Africans from elsewhere. There are issues of complications where the government is complicit in that you have training posts that are not funded. So they would allow people from outside who pay for themselves to come into the training post. And I suspect there might be illegal exchange of money, even in those for them to get in. So understand that institutional racism, sexism, is part of the DNA of our tertiary institutions and training platforms. And we asked the Human Rights Commission to get in and investigate. To date, I'm not aware of anything that has been done in that regard.
And it's very, very interesting that you note that, because my next question was, if nothing changes, what's the risk, firstly, to the profession, and secondly, to us, patients themselves?
Well, the risk to the profession is that the medical profession, the medical and dental professions have been marginalized in this country. And there are some other things that I hope to remind the minister of. Quite a few years ago, he got a report in 2015 from the Mayosi Commission that he had commissioned about the challenges in the Health Professions Council of South Africa. And the recommendation was made to the minister to unbundle the council so that we restore the South African Medical and Dental Council as a separate unit. If you go back during the days of the South African Medical and Dental Council, no doctor wanted to appear in front of council. And it ensured that doctors conducted themselves properly. Doctors and dentists conducted them properly. The minister now has come back, and it is time for him to implement the recommendations of that commission. in honor
Mm.
of the person that chaired that commission, so that we can restore the profession to its ethical values and putting patients first. But
Mm.
at the same time, the welfare of doctors must be taken care of. They should be appropriately remunerated. We should have proper staffing norms. Burnout is the middle name of the frontline healthcare professionals in this country.
Hmm. Hmm. Very, very concerning. I mean, we're even seeing some medical practitioners, doctors, essentially losing their lives because of the amount of pressure and work that they have to do. Lastly, before I let you go, Doc, I'm just veering off the topic that we're having, but I think it's important since you're a member of Parliament and someone that has been heavily involved in the South African medical health fraternity for a long time. The biggest story in the last few weeks has been South Africans who in public clinics and public hospitals have been essentially chasing away foreigners, undocumented migrants to our health institutions. Your response to this? Anything to point out? Anything to say?
As Action SA, we've submitted proposals for changes to the Constitution. Section 27 of the Constitution starts by saying everyone. Would like it to say citizens. We are making ourselves international darlings at the expense of locals. You have courts that have interpreted that anybody can come here and is entitled to healthcare. That's what everyone means. So we need to change that. Otherwise, health becomes an unfunded mandate. And if privileged South Africans feel it should be for everyone, then everyone should be going to where privileged South Africans go, which is the private sector, not to go to an underfunded and already burdened public healthcare system. The second issue that needs to be raised is that a few days ago, we were celebrating the 70th anniversary of the Freedom Charter. It also talks about South Africa belonging to all who live in it. Today, it is not appropriate. South Africa should belong to its citizens, not to all who live in it. So we need to begin to ensure that being an ordinary citizen ceases to be a disadvantage in this country, in this democracy. That's what needs to be done. But what healthcare professionals need to know is that when you sit in a hospital, if a patient presents in front of you, you follow your oath. But the administration must do its job. There are rules, there are international norms where no one may be refused emergency treatment. But we can't have the rest of Africa being chronic patients on our system. That should not be allowed. But we also need to be mindful of unlawful behavior. So to those that obstruct people that are seeking healthcare, do not obstruct them at the point that they come in to seek healthcare. But if you verify that people are not documented, when they come out of the facility, you can make a citizen's arrest in accordance with the laws of this country and hand them over to the immigration officers, which is what the authorities are expected to do. It should not even be left to citizens. Officials in hospitals, once they've processed someone and they know that that person is undocumented, have a duty to report that individual to the authorities so that you do not have citizens taking the law into their own hands. Let administrative officials in our institutions fulfill their legal obligations in accordance with the Immigrations Act to report those that are undocumented to the authorities. It should not be about denying them care, but we should be clear. We should be clear that we're building a health system for citizens, not for the world. Otherwise, it is an unfunded mandate. And that is why I will be putting a members' bill that says all public officers, all office bearers like myself, all public officers like the president of this country, all public servants, all people that work in the public system all of us by law, must be compelled to use the public health system for our health needs. If we do that, this health system will be fixed in no time.
Hmm. And I can tell you for sure that's something a lot of ordinary South Africans would really appreciate. Dr. Kgosi Letlape, thank you so much. Always a pleasure chatting to you. And yeah, all the best.
Thank you, and thank you to the listeners. And all I can say, it is time we all stand up to rebuild our country for all of us.
There you
Black,
have it.
white, pink, blue, male, female, trans, all of us matter. And all of us must stand up.
There you go. That was Dr. Kgosi Letlape, actually an SA Member of Parliament. He's also a health activist and founder of the Africa Medical Association. Yeah, and someone who has never been afraid to challenge injustice in the system. Now, the question is, will this report spark meaningful reform, or will it just gather dust in a pile of other ignored inquiries that we've seen throughout the years? We've had the excuses, we've seen the denial, but what about the reality on the ground for doctors, for patients, and most importantly, for public trust in healthcare? And yeah, it would be something if that motion is tabled where all public servants, members of parliament, everyone that is working for the state of South Africa is by law required to use public healthcare facilities. Right? Maybe that would be the beginning of a change. And do you think they would let that happen? Imagine a Fikile Mbalula at Barra, mandated by law. That would be something. You can engage with us. I want to hear your thoughts on this topic. Our studio line is 0106176600355. You can also engage with us on our various social media platforms. Have you or someone experienced racial discrimination in the healthcare system, either as a patient or professional? I think that's one that we can also unpack. You can give us the scenario. What happened? Was there any kind of recourse that you seeked? Again, you can send us a voice note or give us a call on our studio line, which is 0116800355. And you can comment on our various social media pages. Just search at Salam Media. We're going to see a quick break. When we come back, we'll be looking at our hashtag Africa Focus feature, and we'll be featuring Rwanda right after this.